Hi everyone, my name's Andrew. I'm an occupational therapist here at Wyandotte Hospital. This in-service here today is to train you on how to properly put on a gait belt and safely transfer a patient. So, in order to put on the gait belt, we break it down to three components: the tongue, the teeth, and then the mouth. What we do is we take the tongue, we thread it through the teeth, and then through the mouth like this. And that lets you know that it's properly fastened through the gait belt. So, before you put the gait belt on any patient, you want to be mindful of any precautions, whether it be hip, knee, or stroke side. All those are very important to be mindful of before you get the patient up so it's safe. So once you get the patient up, you want to make sure, before you get the patient, you want to make sure everything's set up, your environment. You want to make sure your chair and all the lines are on the proper side to get the patient up. Once they're up, you're going to have them put the gait belt on them just above the hips. Now, if they have anything like in terms of spinal precautions, abdominal incisions, drains, you're going to want to put it just above the chest region right here. But also being mindful if they have any defibrillator or any ports like that for safety. Also, is also a very good spot for patients that may be pregnant or obese as well. Okay. So, we have our patient Tina here. We're going to practice putting the gait belt on her. Hello, Tina.
Hello.
We're going to slip this gait belt on you. Can you please lean forward for me? So lift the arms up. We're going to take the tongue, thread it through the teeth. It needs to be very secure because once we stand the patient up, it's going to loosen up a little bit, so you want to make sure it's tight just enough. So once we put the belt on the patient, we'll usually have a little bit of tongue. We're going to tuck it right in here so that way it's safe and it's not going to bump up or get caught on anything. So before we get the patient up, we're going to make sure it's nice and tight. We want our patient to go ahead and scoot forward in the chair a little bit. Just like that. Good. Again, we want to make sure our chair's already set up for us, our lines are prepared. Before we stand the patient up, we want to make sure that their hands are on the proper surface. So either the arms of the chair or the bed. Once there, you're going to take your hands and you're going to reach behind the gait belt and you're going to bend at the hips and knees like so. I'm kind of angling myself a little bit just so you can see me, but typically you want to be right in front of the patient. So what you do is you're going to have them rock with you. You're going to go up on 3. 1, 2, and 3, and they're up. What you're going to do now is once they're standing and we're getting ready for the transfer, you're going to have them walk and turn and pivot. You're going to keep walking back and you're going to ask them if they feel the back of the chair. Can you feel the back of the chair?
Yes.
Good. You're going to take both arms and reach back for the surface. As they're lowering down, you're bending with your hips and knees, slowly helping the patient descend. Now, for a patient who's more ambulatory and they need to walk to the bathroom and everything, we'll introduce a walker. So, for a walker, it's important to be mindful for a couple of things, and that's the height of the walker. Our system that we usually use is we measure about just above the wrist region right here. So, for us, in Tina's situation, it's already been set for us, so we already know. What we do is we bring the walker in front of Tina. A lot of patients are going to try to grab it right away. We tell them they tell them not to grab it. What we're actually going to have her do is push up from the surface she's coming from. We're going to stand at the side, and we're going to grab behind the gait belt right here using underhand grip. You always want to use an underhand grip whenever you're picking up a patient with a gait belt. So on the count of 3, we're going to rock up and stand. 1, 2, and 3. Now grab the walker. Good. Now as they're walking, she's going to be going forward, and we're going to be slightly to the side and back, having control of the patient as we go. We're going to pretend this is the bathroom right here. We're going to walk to the commode. So Tina, turn to your right for me.
Oh, sorry.
That's okay. Keep walking back until you feel the back of the surface against your legs. Do you feel it?
Yep.
Typically, if they can reach back for the toilet, that's okay. If they not, we'll have them reach back for the grab bars. And they'll lower themselves like so. Good. And that's how you kind of do toilet transfer. So, now let's say we have a patient who is very obese or in a situation they're very big and where it's not safe enough for us for the transfer of the patient ourselves. This is when we have a second person come in. So we have another person right here. And You know what, let's walk back to that surface right there so that way we have a better angle for the camera. So let's stand up, pushing up from the surface. 1, 2, and 3. And right to the... Go ahead and turn that way.
This way?
Yeah. Turning. Making sure they feel the back of the surface.
Yep.
Go ahead. Reach back for the chair. Have a seat. Okay. So now we'll begin the two-person transfer. What we want to do is, again, we want to make sure our environment's set up for us. In this situation here, we have Tina here and Julie here. She's going to help us. So this is a situation where it's just not safe enough to transfer one person. So what we do is we're going to, a lot of people like to grab under the arm. We try to avoid grabbing under the arm because there's a lot of sensitive nerves and muscles that can cause injury by putting our weight and their weight under their arms. So what we're actually going to do is we're going to take our arm, we're going to scoop under. Go ahead and stand up just for a second, Tina, so we can kind of see. And you're going to turn around just so they can see how we grab it. Hand's going to go in just like this. So it's almost like a similar way like you would grab under the arm, but you're grabbing under the gait belt. And then your other hand can often go right here as well, or right here for comfort. So let's go ahead and have a seat, Tina. Have a seat back in the chair. It's important for you and your fellow coworker to communicate with each other, you know, when to stand up and when to sit down. So in this situation, I'll mention that I'm the lead. Okay, Julie, let's go ahead and wrap our hands around the gait belt for Tina. Yep. Great. That's okay. So we're going to grab here. All right, Tina, on the count of 3, we're going to stand up, okay? 1, 2, and 3. Good. We're going to turn. Good. Keep going until you feel the back of the surface. Do you feel it?
Yep.
Go ahead and reach back. And we're going to bend at our hips and knees. And lower her down. So just a couple friendly reminders as well that we didn't mention in the beginning. Before you get any patient up, it's important that they're wearing their proper footwear. So either their yellow socks, their shoes, no flip-flops or anything like that. Again, you want to make sure that the environment's set up and it's well lit, and that you're aware of this patient's cognition as well, so they can follow commands. Thank you very much.